Hello, hello, hello. Hey, everybody. This is your girl, Christal, with Let's Get Christal Clear. And I'm excited about today's interview because it's one that I'm sure most people want to hear from right now. We're going to talk to Dr. Kendra Segura from Married to Medicine LA, who is an OB-GYN. And as we know, we're all home. We're all trying to figure out what is going on. To me, the most comforting words that I can hear during this time are usually from a doctor, especially because I know that there are some ladies out there that are pregnant. There's some ladies that are expecting, and all kinds of things, all types of concerns are going on. So I'm really excited about my next guest. You guys, please help me welcome Dr. Kendra Segura. Let's get Dr. Kendra in here. There she is.
Hey, hello
Hey.
everybody. Hi, Christal, and thank you for inviting me on.
Oh, of course. Good morning. I know it's pretty early there on the West Coast. How are you and your family dealing with everything right now?
You know what? We're just as stressed like as everyone else, especially because Hobart, my husband, he is a physician as well.
Right.
So, thoughts that everyone has, what if you do contract COVID? What if you're exposed? What if you're asymptomatic and then you come home and you bring it home and I have a 9-month-old baby, so it's kind of like all the stresses that I hear from my patients, which is, the frustration of being at home and not being able to do the extracurricular activities that we normally do.
Right.
Because some people are working from home. Me and Hobart, we are, going to work, and I hate the word, I guess, essential worker, but I get it because we're all essential. Some of us are working from home and some of us are just on hold for right now.
Right.
But so we're going through it, as well.
Yeah. Well, I definitely appreciate you saying that everyone's job, is essential, but we definitely salute you all for doing what you do, because I think this has shown us just how important and how much we need to make sure that we appreciate and thank and hold in higher regard, our doctors, nurses, assistants, everyone that, works to help keep us safe. Now, you're an OB-GYN, so I can't imagine what your patients are going through. Is that we're all concerned, but when you're a new mom, especially a mommy to be, the idea of we all become this mother bear trying to keep our baby safe. So what suggestions are you giving to your patients and then other women that may be out here pregnant and stressed anyway, but that adds additional stressor? What is your suggestions for them?
You know what? First, Christal, I'd like to tell women to give themselves a break. Take a big deep breath, because the hormone changes in pregnancy, especially when you're in the beginning, when you're in the first trimester, that actually can add to your existing anxiety or depression or create it.
Wow.
So for myself, I remember, when I was in my first trimester and I was, of course, ripping and running, working at the hospital, working in the office, just going.
Right.
I had high anxiety, and I had to kind of doctor myself and say, Kendra, this is because my body is changing. I'm creating life inside of me. All the blood supply is getting engorged, and this is a miracle that's happening inside of me. So I remind pregnant women and new moms that your anxiety, just if it wasn't a COVID climate, that you're already on edge. Already.
Absolutely.
So given that and the what ifs. Okay, what if I contract COVID? What if my husband brings it in? My partner brings it in? What if I go to work and I get it? And so there's so many different things in the media, Christal. And I just want to really make this clear. I'm so happy that we get to talk about this.
Absolutely.
Because, medicine, and especially something new like novel COVID-19, right? It's forever changing with the research, with the data, with the numbers that we're getting. So I tell patients, just because I may say, or you hear on the media, or any other entertainment outlet, because everyone is touching upon COVID.
Yeah, and
you gotta be flexible.
Stories coming from everywhere. That's what's really confusing, I think, for a lot of people as we hear. And I've actually even heard doctors, like you said, saying different things. And I think people are very confused. And that kind of leads to additional anxiety when you don't really know what is the right thing to do to stay safe, right?
Right. So I always say, go back to the basics, because I could be talking to you today and something new comes out about how you even can get COVID. Right now, it's per respiratory droplets. So I say to my patients, just be flexible, because the data is in real time and our advice is not in real time. Our medical education as we know it is not in real time. So I say, go back to the basics. I say, what do we know? We know that pregnant women, babies, older people are at risk. Right. So you're going to do the basic things that you normally would do to keep yourself healthy. Stay away from sick people. If you are sick, you know, measures of washing hands. Okay, that's always been there, but now it's like everyone's doing videos, wash your hands, doing dances about it, you know, and basically taking your vitamins. And when you're pregnant, it's your prenatals. And so basically just to stick to what we do know and to take precaution and contact your doctor if you are feeling sick, and to kind of stay away from, I really like my pregnant patients to stay away from sick people. So even if it wasn't the COVID climate, why? Anything. Because I can't give you the medications. All the medications are not available to you if you are pregnant. So that's the thing. I cannot imagine. Like I said, that's got to be a high stress thing. And I'm assuming that since we're all quarantined, there are probably going to be a lot more pregnancies coming up. Christal, if I can tell you yesterday, how many patients came in just to confirm their home pregnancy tests?
Oh my gosh.
I'm going to be everybody. We're all going to be busy like in 9 months. Okay.
Well, that's good for you.
But women are coming in not only for, you know, with positive pregnancy tests, they're coming in with vaginal trauma. Okay, due to rough sex. And I was talking to a friend the other day about this, and I know we can sit here and kiki and laugh about it, but no, that's a real thing. Women coming in with vaginal lacerations, abrasions, excoriations due to rough sex. And I think that's attributed to, you know, people can't really, their fear of going outside to exercise, gyms being closed, and just downright frustration. You know what I mean? You're quarantined and you want to get all that out, you know? So let's be careful with that.
Let's be careful. Well, let's just talk a little bit about that, because I know that this time a lot of people are not going to their doctors for things that you're not going to the doctor as often as you may for other things, right? Because it's going on. So if someone is dealing with something like that, is there something that they can do at home, or should they immediately go to the doctor to deal with that? Or because I know a lot of people are a little bit anxious about even going into a doctor's office right now because they don't want to be around other sick people. So at what point do we need to go to the doctor? Can we call our doctor? What do we need to be doing with things that may not be a life or death situation right now?
That's a great question, because yesterday I had a patient who actually was pregnant, and she came in for her first prenatal at 17 weeks. Okay. And that's far along. We missed a lot of testing in the beginning. And I asked her, you know, why? Because sometimes it could be transportation issues, insurance issues. And she said that she was afraid of getting COVID. So she just stayed home. And now that she's kind of getting bigger, she knows she has to get some testing. And I'm like, yes. So now, thank goodness that the government now, for a lot of facilities, including my own, the Women Wellness Center right in the heart of South Los Angeles, we're approved now for telephone visits. Nice. So that is what I would tell patients. Okay, if you're anxious, you're not sure, set up a telephone visit. And with that, versus just calling into the office, you set aside a dedicated time, 20 minutes with the physician. Nice. You don't go through a triage. You don't go to someone else.
Talking to another, talking to your physician.
Right to a physician, so we can triage you. And we can say, you know what? These are the things you can do. You need to go to urgent care, go to the ER. But I do want to say this, that a lot of people actually aren't going into the ER. And right now, for most ERs, it's a low census. Meaning that only people who are really sick are going.
I would just say I wouldn't go to ER. I would be afraid to go to ER right now, because I would be afraid of contracting something else that I didn't have when I went, when I got there. So I definitely can relate to that idea of, if I go there, that's where a lot of sick people are, I may get sick.
Right, but keeping in mind at the same time, some people have pre-existing conditions that are worse than COVID-19. So that's why it's kind of like take the precautions. But if you have to go to the ER because you have pain that's uncontrolled, you know, you're not feeling good, wear the mask, wear the gloves, call your doctor, okay, and go to the ER. You know, so and then it's faster. Like I said, it's actually a lower census now.
Because everybody is afraid.
Right, because you know, girls aren't coming in there for, you know, can I get an STD check? You know, in the ER. Usually that's something that the ER does. That women come in all hours of the night, and you know what? That could wait. And you know, an STD check can wait, but chest pain, vaginal bleeding, and abdominal pain that can't wait.
Right. Absolutely. I wonder, I didn't even think about this idea, but there's probably going to be a lot more issues because people are staying home more and afraid to go to the doctor. So they'll probably be a lot worse when they actually get there. This has just got all of us, you know, totally kind of turned around. So thankful to be able to talk to physicians like yourself and hear that perspective, because that's really what we need to hear so that we know that we're doing the right things.
We're all in this together. Like I said, you know, I just happen to be a physician, but we're all dealing with the same angst and, you know, the concern of getting it. But I say, let's take a deep breath. Let's go back to the basics. There is knowledge. We have power. We have history. We have past viruses that we've dealt with. So we will get through it. But we don't have to go through it alone. So make that telephone visit. So if hello, everybody watching, if unsure, when in doubt, make a telephone visit.
Call your doctor.
Talk to your doctor, okay? And when in doubt, if you're in pain, go to urgent care. Go to the ER. Just go and take precaution, mask, gloves, and, you know, 6 feet distancing when you can.
Okay, so better be safe than sorry. Definitely would rather do that. Well, that's really good advice. I want to thank you for addressing that. We know that I'm excited about this new season of Married to Medicine. I think that, you know, the great thing about this show, and I've been a fan of it, friends with some of the doctors on the Atlanta version, but I love the fact that you get a chance to see doctors, because that's always been a profession that is kind of has a little mystery behind it. And you forget that doctors are real people. Like, I love the fact that you're saying you're a new mom yourself. You're worried about your husband coming home, you know, perhaps, you know, getting sick or you're a real person. So I love the fact that the show is really giving us like a sneak peek into the fact that, yes, our doctors are these amazing people that save lives, but they're also
definitely human, Christal. I'm definitely human. Working on myself daily.
What do you think people can look forward to from this season? I know that, like, again, you having a 9-month-old baby, you know, trying to juggle. I can't even imagine juggling.
And at the time, Christal, let's say 3 months, 2.5 months.
Wow.
So I was still in that phase where I was hoarding the baby. I was in that phase where I had thoughts of taking him, my baby heart, and running to the hills, moving somewhere else. And, you know, I told my husband one day, I said, you know what? I feel like I want to escape. And he's like, well, make sure you take me with you. I was like, if you think if we're going to the hills, make sure you take me with you.
Let's go together. Right. So what was that experience like? Because I think that women especially have a hard time with really juggling, because we sacrifice so much, especially when we have a new baby and we have a husband and even our job. So how did you manage to kind of find a balance that was a good balance for Kendra?
Christal, you know, just the decision to actually do it, like, you know, and you'll get to know me, especially if you watch the show. I'm actually a very private person. Okay. You know, and I was reluctant to do it. I didn't want to do it. Right. You know, but at the same time, because of my new role, you know, I just had a baby. Right. Okay? And when and I had a C-section. Yeah. And, you know, I was breastfeeding, and it does take a village to breastfeed. So my husband was like my postpartum doula. My husband was my postpartum doula, and he really was encouraging me, because I wanted to quit week 3. Right. And so all these things were going on, and I knew about the show, you know, 2 years ago when they reached out to me. And then it just seems like, you know, when I happened to see, you know, Dr. Britton for my preoperative visit, that's a visit that you see before your surgery. And it just seemed like, okay, is God trying to tell me something that I should do the show? Or, you know, I thought to myself, that I wasn't going to do it if I wasn't going to be my authentic self. Right. Okay. That's what me and my husband discussed, because I wasn't ready to do it. You know,
Right.
like I said, you know, I mean, 30 pounds heavier. I just had a baby.
Mm-hmm.
But Christal, I did it because growing up, I never knew doctors.
Right, exactly.
Growing up, I didn't have anybody in my family. No one's in the medical field. I never knew that there was something like physician's assistant.
Right.
I never really knew that there were so many different types of doctors. So I'm doing it, you know, I'm just taking one for the team, and I'm doing it for those girls and those little boys that grew up where I grew up and they don't know anybody like me.
Right.
Or they might think, you know, that doctors are a certain way or fit a certain mold, but no, this was a second love for me. This was a career change for me. And I'm a real person. My parents aren't rich. You know, grew up right there in the hood, South Central.
Right.
You know, and so went to the high school right down the street, never went to private school. So I'm doing it so people who really don't have anyone that they can really know and it's tangible. That's why I said, okay, let's do it. And I knew it was going to be a whirlwind. You know?
Yeah, I love that. And the fact that you said this was a career change. You played tennis. You definitely weren't.
Yeah, I was an epidemiologist. So COVID and all this stuff is right up my alley. You know, back then I was doing the West Nile virus. I don't know if you remember that. So this was right up my alley. But yeah, so I was lost. After, I think when you identify as an athlete, you know, I played tennis. I started competing since I was like, I think my first tournament was when I was 8.
Oh, wow.
So when you go through, you know, competitive junior sports all the way up to college, I played 1 year professional on tennis. I never looked at myself like, you know, like, Kendra, like, you are an athlete. Now what? Like, what can you do? Like, what do you like? So I went through just a period of just doing a little bit of everything. So, yeah, my last job before I just decided to take that leap, you know, everybody thought I was crazy, and I thought I was crazy too. That's when I decided, like, you know what, I can't, you know, epidemiology, like, I'm so thankful for it now. Who would have known that it goes hand in hand with medicine, actually?
Absolutely.
You know, the data, understanding and learning the data, because because the physicians, we implement what the researchers,
the data that
so they actually went hand in hand. So God always has a greater plan. But yeah, I just decided to just, hey, let's be real and let's show people what's up. But I didn't want to come on there with the mindset of, you know, just hiding my life. It sounds funny because you think, well, you're on a reality show, but it's hard to be authentic sometimes.
I can imagine. And then, you know, and then you're married to a doctor. So you are a doctor married to a doctor. That has to be a lot.
Moving in, you know, we moved, and we still have got a couple of boxes that we need to unpack. So that's the life, you know.
Wow. Well, what do you think that viewers will enjoy most about this season? I think this is that they're still getting to know the doctors there in LA. What can we look forward to? I believe it premieres on May 3rd, correct?
May 3rd on Bravo, 9 p.m.
Okay.
You know, if you guys are busy doing quarantine exercises or just, you know, going nuts, and forget to tune in, set your DVRs.
Set your DVR. May 3rd on Bravo.
You know, because I'm still, Christal, I'm still a fan. Like, I'm still an audience member, you know, so I'm just excited about the variety of the different type of women that are actually on this show. Because everyone's a different type of woman.
Right.
With a different backstory. So even the other physicians, totally different backstories, you know, but yet what unites us is the medicine part, whether you're married to medicine, whether you are a physician.
You are a doctor,
There's a variety. We're not the same. All of us are different. And so sometimes that's good, and sometimes
it clashes. Sometimes it can clash. I want to ask you, because a big part of the show is relationship based, and we get a chance to see the doctors in their marriages and in their relationships. How were you able to, number one, how were you able to kind of set a balance for your relationship with both of you guys having such high powered jobs and then also having a new baby? How have you been able to keep the relationship and keep that romance alive with that? And then on top of all that, in front of a national audience?
Christal, like, it's in real time. So remember, all this is happening, and it's still happening. So maybe I can answer that question a year from now.
Okay.
Because that question
Yeah.
We're trying to figure that out.
We're
and
working
now
it
with
out.
the COVID situation, I'm working more.
Mm-hmm.
So we haven't dealt with that. We were
Right.
doing good, and then COVID hit, and then boom,
Right.
schedules.
Right.
We've both been working a lot.
Right.
So yeah, ask me that maybe in a year.
We'll follow up with you in a year, and you'll have some wisdom from this past year.
Yes.
Well, Dr. Kendra, again, I want to thank you so much. If you could just give maybe us 2 or 3 tips before we get out of here, just for everybody that's dealing with this. I know you said go back to the basics, but if there's anything else that we could leave people with, just to give them just a few more words from a doctor. I know that people will definitely be watching this and watching this over again. We're going to put this up on Rolling Out as well.
Okay, excellent. Definitely. To take, everything seriously.
Mm-hmm.
So, I know sometimes, especially now that the quarantine in California is extended to May 15th.
Okay.
The stay-at-home order.
Okay.
So when you kind of get used to living a certain way,
Mm-hmm.
you kind of get lax on following rules. So I urge, whatever state you're living in, please follow the rules. If it's a stay-at-home order, if it's the continuing to social distancing, because I know they're going to eventually, pull back on some of the rules.
Right.
So follow what your local state, your local government says, because it is serious.
Right.
Because I do have colleagues that have COVID-19, because I do have a friend just contracted got tested positive yesterday. People that we know have passed away. So, when we're bombarded through media with something, we tend to get calloused and kind of, just another COVID death. No. So my first advice is please follow whatever local guidelines, whatever rules that there are in place where you live.
Okay.
Secondly, it's hard to tell people to relax when you have financial problems.
Right. That's true.
So it's not easy, right? Okay, you're not working, you can't really pay your bills. So I'm not going to tell you to relax.
Right.
I'm going to tell you to prioritize what you can control, what you need, and ask for help.
Okay.
There are a lot of people out there that are quarantined that are not asking for help. So ask for help.
Right. Don't be too proud to ask for help. Absolutely.
And the third thing, if you are able to, check on your neighbors, check on your coworkers. If you're able to help, whether it's financial, whether it's going to the store for someone, getting groceries, whether it's helping somebody get resources because they can't pay their bills. So we all have to help. So it's helping by following the rules, the local, state government. It's kind of trying your best to prioritize.
Right.
And I think that will lower the anxiety. And third, you got to reach out beyond yourself and your family to help. And if we have that kind of community, we're going to get through this, and it's going to end soon.
Yeah, I love that. Thank you so much. Great advice from Dr. Kendra, but just real life advice that we can put to use in real time. Thank you so much. I want to encourage everybody to please set your DVRs for Married to Medicine on May 3rd.
Disappointed.
Yes, we're going to do all this together, and we'll check in with you guys later. Thank you so much, Dr. Kendra, for spending some time with us this morning.
It was a pleasure. Thank you so much, Christal.
Okay, thank you a lot. Bye-bye.
Okay, bye-bye.